been accomplished this year. And Mr. Sexy covered some of those, so I'll go over them really quickly. Appreciate that, Ryan. Rebasing, last year we were able, for the first time in, I don't even know how many years, 7 or 8 years, that we were able to get rebasing for our care centers, and that was very helpful. It's very, very, very much appreciated, and made a big difference to us. The GAT payment plan, upper limit, that's still in the works, but we're told that that's coming very soon, so we're excited to see that as well. That'll make a difference. But I think that something that's been very, very beneficial has been combining Leading Age Wyoming and Wyoming Hospital Association. That has been very helpful on the advocacy levels, where I'd like to just talk about for just a couple minutes. And that is having one voice speaking to our legislators about both. And it's really interesting. Elaine Harvey is from Lovell, and she's the joint chair of the Labor Committee. And so she and I talk quite a bit, and she's told me several times how meaningful that is to them to have just one voice representing both, and having the same unified voice, understanding them both so well. I think that's a great reflection on our leadership of Eric and Neil. I'm not sure, well, Rose, of course. She runs the legislature too, somewhere behind it, and Barry as well. But I do believe that that's been very, very helpful, having them as, and not only being a unified voice, but they're also recognized as a leading voice, as an expert voice. And so that carries a lot of weight and a lot of credibility with our legislators. And so because of that, we're seeing some great things happen. I know that there were some issues that were not expected to pass that did. There were some that they thought might and didn't. And I think a lot of that had to do with the fact that these guys worked so hard. So I really appreciate all of that. So now I'd like to transfer over to introducing the Norman S. Holt Award winner. Tina Toner is the first one from our facility to ever have won this award, and we're really, really excited for her. And so, not knowing exactly, I have a little bit I'd like to say on my own about Tina, but I asked her nurses to put together, excuse me, a few of their thoughts, and so I have some of those too. And she doesn't know that I'm about to. Well, she didn't know until just now that I had done that. So I wanted to share some of those thoughts. But when I was hired as a CEO, when I got this job, I was told that, oh, and by the way, we just interviewed for and hired a new CNO. And I thought, well, that's kind of odd. You know you need a new CEO, and usually the CEO sort of likes to be involved with that discussion and hiring a new CNO. So I hope I like her. I hope we can work together. I hope things work out for us both. And it has. I'm so impressed and so happy to work with Tina. When we first got there, well, this is her, not me, but when she got there were some things that had gone on for a long time that were accepted as standard practice, and they were okay, but it was just not what Tina saw as her vision of how it ought to be. And so she fearlessly and patiently tackled those things. And one by one, all those hard items that she decided needed to be corrected and taken care of were. And she knew that there might be a hit on her personal popularity, if you will, but that's okay, because she tackled it anyway. And the dividends are paying off wonderfully. I'd like to, we talk a little bit, well, we talk a lot, and I value Tina's friendship, I value her insight. She's very smart, and I'm not going to, I know some of the things that she wants to talk to you about, and so I'm not going to talk about those, except for just this one thing that I'm not sure she's going to say, so sorry if you are, Tina, but Tina is very well educated. She's got a master's in nursing and an MBA, and so she brings a lot of expertise from both levels. I've worked before with CNOs that say, well, just trust me, it's nurse math. Well, I don't know what nurse math really meant, but Tina doesn't have to rely on nurse math. There's other, well, it's okay. She's done a wonderful job. She's done some great things. And so I'd like to take just a minute now and read some of the things that her nurses said about her. There are not enough words to adequately express our thoughts and feelings about her. Tina pours her heart and soul into this hospital and to us nurses. She's available to us 24 hours a day. We all know that if we have any issue regarding work, that Tina will fix it. She truly is concerned with our happiness. She is supportive and understanding of our issues. Tina is a true patient advocate and shows her compassion for patient care each day. Tina is respected by us as nurses, her fellow peers, and patients. We all feel blessed to have her as our CNO leader and friend. And then some others also made some comments, and I'd like to just share some of the characteristics that they said that she has. Strong leader, compassionate, positive, generous, caring, dedicated, understanding, beyond in everything she does, on call 24/7, makes herself available to nurses at all times, and always has her door open. Except for she has a sign that says, if this door is closed, it's because I'm rounding on the most amazing nurses on the planet. So with pride and with gratitude that I introduce to you Tina Toner, Norman S. Holt Award winner of the year.
Thank you. Please sit down. I feel really ill-equipped to come up here and talk, especially after Mr. Sexy and Rick. I think Rose could do a better job from on here about her as well. But thank you so much for this honor. I feel very humbled and very proud to be recognized. I know what amazing nurses we have in our state, and so it is just truly an honor to be up here, and I really thank you. I wrote two different sets of, I wrote notes on this type of paper, and then I wrote notes on sticky notes, and I think I'm just going to wing it. I was asked recently how I became a CNO, and the only answer that came to mind is, you don't want to do it the way that I did it. It was kind of an interesting route. I feel like the reason that I'm here is because of the people that I've been blessed with in my life, all the people that have supported me. And so really I want to talk a little bit about what they did to help me. So to do that, I want to start actually with a little background about me. I was raised in a small town, Lewistown, Montana. My dad was a police officer, my mom was a banker. And I was the oldest child, and I was rotten. I was a horrible, horrible teenager. I did everything wrong, very bad, very, very not well behaved. And I was one of those kids that the teachers always at the conferences would say, you know, she has so much potential. And in fact, one of my teachers had told my parents, she's going to end up pregnant by 16. And it turned out he was right. And when that happened in this small town with very influential parents, it was in 1990, and it was very hard. And I didn't have a lot of support at the time, and a lot of people who had seen that potential in me were very disappointed at what had happened. So I was struggling along with that when all of a sudden I had my son premature. He was 9 weeks early. And my first thought was, they're right, I can't even get pregnancy right here. I'm going to be a horrible mother. And so we were in this small town, so they shipped my son to a bigger hospital in Great Falls, Montana, 2 hours away. And I was, of course, at this time I was 16, limited funds, limited means to go, and I wasn't up at the hospital every day. And when I did come, there was a lot of people who I just could see the worry that they had for me and my son, the worry that they had about the outcome that we would eventually have, and pity, and sometimes even more than that. When that happened, at that time, I really didn't know how I was going to be a mom. But they started to try and teach me some skills, how to bathe him, how to work his apnea monitor, how to give him his medication and that sort of thing. And I had a month to learn how to do that before he was to come home. And so there happened to be a nurse there that did more than teach me those skills. She started really looking at me as a person, and it was the first time that I actually felt like someone believed that I could be a mom. While she taught me skills, she talked to me a lot about what I could do in the future. She talked to me about nursing. She told me it's only 2 years and you work 3 days a week, the biggest lie of nursing that everybody knows. She told me about teenagers that have went on and went to college, and she really encouraged me. And with her support, I was able to go home with my son, and I think I did a pretty good job. I was home for a while, and things were going along okay. I had a few things that, it was hard. I was a good mom, but it was a hard time. When I had gotten pregnant, that same teacher that had predicted that I would be pregnant, at one time, after I had my son, he also predicted another thing, and he said I was going to end up working at McDonald's for the rest of my life. And still, to this day, that's a very painful thing for me to remember, because I believed him. He was right the first time, and I really believed he was right this time. So it came to be about my high school graduates, and so I put him up on my hip and stood there, and I watched my friends graduate. And I looked at that teacher, and he looked at me smugly, and he was right. I was working in fast food. I wasn't working at McDonald's, but I was working in fast food. And as soon as I thought that, another thought came to my mind, and I thought about that nurse in the NICU and how she told me that I could be more than that. This was in May of 1992, and by September of 95 I was enrolled, and I was at Montana State University Northern in the nursing program. And I thought about her that day, and I'm so thankful that someone at that time in the NICU looked at me as more than just the stupid good people that have had hard choices to make, and that maybe just if one person believed in them, that their story can be different. And I thank her every day that she saw that in me. I have to get to my notes for a minute. I don't know her name. I know she had triplets, and she talked to me a lot about how she cared for her kids at home and how she was a nurse and she could handle that. And I still don't know her name, and I still have never been able to thank her in person. But I do want to go ahead and thank her now, because without her, I just wonder I wonder what would have happened to me here at the same time, not knowing who each other would be. I just have kind of a laid-back personality. I felt at the time that I'm sure he won't be that bad. I'll go with it. And he has surpassed, everything that I could ask for in a boss. We have laughed together, we've worked hard together, we've sat through so many meetings together, we've shared personal strife together, we've needed to hug and cry as a group together, and we've checked into way too many hotels together. In fact, and I think it was last year, it might have been at this convention, at one time Rick, I introduced myself, I said I'm Tina Toner, and the person said, oh, like Tina Turner, and Rick said, she's never heard that before. He's heard it so many times with me. But he is more than a boss, he's our friend, and he believes in us, and without him, I just can't even imagine what I would do if I didn't, when something bad or something good happens at work, that's who I want to go and tell. And so thank you, Rick, for letting us be the best employees that we can be. Our leadership team is just a reflection of Rick's leadership. We are friends, we trust each other. I'm looking at them, they're probably going to give me funny faces because that's the type of people they are over there. But I trust these people with my life. We are not a rubber stamp club. We have all different opinions and we share them and we come up with the best decision we think for our hospital. They're really great people. Our frontline staff and leaders, and especially our nursing staff, like Rick mentioned earlier, these are the most, I know I've said amazing a lot, but I can't think of another word to describe the staff that we have. If I called them right now at this minute from this conference and said, can you come to work, there's an emergency, they would be there. They care so much about what we do. We were asked earlier in one of our presentations about if we could say that every nurse that we work with, that we want them to care for our family, every provider that we have at our hospital, I can sincerely say yes. Every single one of them I would trust with my life and with my family's life. So they're truly special people. I do just want to thank my mom, dad, and sister. While I didn't, of course, when I spoke earlier about not having a lot of support, they of course came around, and as soon as that baby was born, they were right there, right beside me, proud. They have always loved me and been proud of me, even when I've made mistakes or when I haven't been the best that I can be, and I really thank them. My husband, he actually has encouraged me for every position that I've ever had. He has encouraged me and told me that I could do it. In fact, this last position I was in here at North Bighorn Hospital that I've had for the last 7 years, I was visiting my grandma in Minnesota, and he applied for the job for me before and told me about it when I got there. He said, I think you can do that job. And I was like, no, I can't. And he truly believes in me, and without him, again, a great supporter in my life. Really quickly, I just want to mention to my kids, my 5 little heartbeats. We've got 5 kids aging from 25 to 4. Blaine is our surprise baby. He's 4 years old. We call him the bonus baby. And he's still at the stage right now, like he wants to, the last thing he said to me is he wanted to marry me when he grew up. And he's amazing. My Evan, my 13-year-old, he's the sweetest, smartest boy ever. He's a genuinely very loving child. Maddie, my daughter who came here as my date tonight, she is incredibly talented and smart and beautiful, and she would like to be a nurse when she grows up, and she would be an excellent nurse. My daughter Lauren, she's 21, and 2 weeks ago she went to the boot camp for the Navy, and I haven't had a letter yet, and I haven't had a phone call yet. And as we drove over here, I got a call from the florist, and she said, "I have a delivery, but you're not home." And I said, "Oh, I'm going to get an award. I'll be back." And I said, "But can you tell me who the card was from?" And it was from my daughter. She had prearranged it a few weeks ago for me to let me know she was proud of me. She would love nothing more than to be here. And then finally, my son Sean. He's 25, and he's the reason that I'm here, and the reason I became a nurse. And I just wanted to share a little bit about him. He joined the Air Force. He served 4 years. He's a veteran. He was deployed. He got back home about a year and a half ago and started going into school, to college. And in about May of this year, he called and let me know he was accepted into the nursing program. And so he's not. I don't ever end things good, do I, Rick? He knows that. I can never stop talking. Thank you all. It's truly an honor, and I just hope that as all of us that are working in healthcare in whatever area that we're in, especially the nurses that are near and dear to my heart, just look at our patients differently if we do one thing. I was told in nursing school that there's never a bad patient, just a patient with an unmet need. And I really, really believe it. I think if we can show compassion and empathy and find what that patient needs, that we can help them, and that's our mission. So thank you very much.